Street and intensifying fears over coronavirus have the White House and Congress debating a key question. What, if anything, should be done to boost the U.S. economy? Well, President Trump has a few ideas.
And discussing a possible payroll tax cut or relief, substantial relief, very substantial relief. That's a big number. We're also going to be talking about hourly wage earners getting help.
But any kind of stimulus may be a hard sell up on Capitol Hill for Democrats, as well as Trump's fellow Republicans, some of whom say the move could be premature. With me now, Democratic Senator Tammy Duckworth of Illinois. She is an Iraq War veteran, a Purple Heart recipient, and she is also a member of the Armed Services and Small Business Committees. So, Senator Duckworth, welcome back.
Thanks. It's good to be on.
So we know several proposals are being contemplated. You have, the paid sick leave, a payroll tax cut, deferred tax collection for industries like airlines, cruise lines, hotels. And I know you know a lot about small businesses, right? Making small business loans more available. Which of those options would you support?
Well, I think long term we should consider all of them, but in the short term, I think that what we need to do is take care of the individual worker first. So I would like us to see a streamlining of the ability for people to apply for unemployment insurance. A payroll tax cut doesn't do you much good in the short term if you're not getting a paycheck. What we need now is for hourly workers and people who will be told stay home and you're not going to get paid to be able to get some help. And there is in the law the ability to allow them to get unemployment insurance in the short term because they can't get to their jobs through no fault of their own. And we need to streamline that process. And then, of course, we need to definitely look at paid family leave. I've been talking about this for years now, so that people can actually afford to stay home and take care of their family members.
Mm-hmm. You know this, the economic fallout, Senator. Just one aspect of the coronavirus spread in the U.S. Another issue is testing, and whether officials have a handle on how many people. And I just want you to listen to what Health and Human Services Secretary Alex Azar told CNN just this morning.
We don't know exactly how many because hundreds of thousands of our tests have gone out to private labs and hospitals that currently do not report into CDC. We're working with the CDC and those partners to get an IT reporting system up and running, hopefully this week, where we would be able to get that data to keep track of how many we're testing.
So bottom line, Senator Duckworth, the CDC chief today says that the agency has tested nearly 5,000 people in public health labs. That doesn't seem to include private or clinical labs. And you heard Secretary Azar saying, well, we don't totally know. Your reaction to that?
Well, the administration has absolutely botched this. Let's compare it to the case of South Korea. Within the first week of the first case that appeared in South Korea, they had tested 66,000 individuals. South Korea, a country far smaller than ours, has managed to test over 140,000 individuals so far. And the trend in these other countries that responded very quickly with test kits, widely dispersed, is on the way down. Whereas in the United States, we're a far richer, more powerful nation. Our trending is in the opposite direction because this administration has failed to respond. In my own home state, we ended up coming up with our own testing in order to figure out who had this virus and begin the protocols ourselves. So we'd waited for Health and Human Services, for the CDC. We would have been in far worse trouble than we are right now.
So if in your words, this administration botched it, what do we do about it, right? Tom Bossert was President Trump's Homeland Security advisor, and he wrote this op-ed in the Washington Post, and he talked about how we need to be pretty aggressive, right? We need to get proof of human-to-human transmission in a community, and then moments ago, the governor of New York announced the National Guard would be deployed to an area in New Rochelle here in New York, just to help with logistics in a containment area, and that schools would be closed in that area for 2 weeks starting Thursday. My question to you, Senator, is just how aggressive do you think the rest of the country should be?
We should be very aggressive in getting these test kits out. The problem we have
But what
right
about
now,
beyond that?
Well, no, but we need to know where people are who have this right now. So we need to get everybody tested at this point. And we can't, and the Trump administration, look, they're saying there's 75,000 kids or 1 million tests. There's only 75,000 kids. We got to get the people tested everywhere. And then, yes, we need to get folks to be able to stay home and self-quarantine. We got to make sure our kids are not passing the virus around. And we need to make sure that the test kits need to be free, because if you are told that, hey, there's a 2-month wait for a test kit through Medicare and Medicaid, but if you want to get tested, it's going to be $500 or $200, then you're not going to go get tested, especially if you're making the minimum wage. So let's get these test kits out. Let's make them free so people will know whether or not they have been they're positive, and then let's allow the public health officials and the scientists to really tell us what we need to do next. That's who I want to listen to, the scientists, the doctors, and let's follow their advice for a change.